Hi, welcome to Happy Health Center. Today we will take a deeper dive into the processes that help us function more efficiently as a team. We strive to improve primary care to better serve our community. We utilize team-based care to achieve that goal. The 5 key principles that support team-based care are building trust, clear roles and expectations, practicing effective communication, shared measurable goals, and tracking our progress towards those goals. In this video, we will be discussing empanelment. Empanelment strengthens the patient-provider and patient-team relationship, which is essential for patient-centered care. It connects each patient with a primary care provider, PCP, and a care team to manage their overall health. Empanelment promotes continuity of care, offering stability for practices to better manage patient health. This consistent patient-provider and team relationship enhances communication, improves identification of care needs, ensures consistent treatment, and ultimately leads to better clinical outcomes. Empanelment is a foundational step for healthcare system change. The quintuple aim includes improved health outcomes, better patient satisfaction, enhanced staff experience, lower overall costs, and greater equity. What is empanelment? Empanelment is the process of matching each patient with a PCP and care team while considering the preferences of both the patient and their family. It defines the population of patients for whom a provider and care team are responsible. The primary care provider, PCP, and the care team, which may include medical assistants, nurses, care managers, behavioral health staff, oral health staff, and other personnel, shift their focus from simply providing care to individual patients who appear on their schedules to actively managing the health of the population of patients that are assigned to them. This transition requires a proactive approach from both the provider and the care team to ensure that each patient in their care is engaged in receiving optimal treatment. Empanelment ensures that patients are thoughtfully matched with primary care providers via a well-organized and transparent process. This strategic assignment enhances the delivery of care, fostering strong, collaborative healthcare teams dedicated to patient well-being. Let's head back over to the Blue Pod and see if we can observe how they have implemented empanelment in their practice. Empanelment enables our care team to assist all assigned patients, regardless of them having an appointment. Effective management also involves identifying patients due for care and reaching out to schedule needed services. The front office lead for the care team is usually the first face that patients encounter and the first one to pick up the phone. Because we utilize patient panels, when a patient calls, they are easily able to identify their care team and efficiently route their questions or schedule them appropriately. Every patient gets a primary care provider assigned to them. If someone doesn't have a PCP yet, we look at their appointment history to figure out the best fit based on sensitivity to patient and family preference and which providers are available. We also keep an eye on how many new patients are coming in and check if the PCPs have enough space in their panels to take on more patients. One common method of determining how to assign patients is called the 4-cut method. The 4-cut method can efficiently assign patients to PCPs for large lists of patients. It can be applied to patients who are unassigned or to patients who are assigned to a provider who is no longer at the practice. First cut. Assign patients who have only seen one active provider over the past year to that PCP. For the second cut, assign patients with multiple providers who mainly saw one over the past year to that PCP. This fosters continuity of care. For the third cut, assign patients who have seen 2 or more providers in the past year to the provider who performed their most recent physical exam. And for the fourth cut, you will assign patients who have seen multiple providers and not had a recent physical exam to the last provider they saw. After using the 4-cut method, review the preliminary panel report and make necessary adjustments given panel sizes. It's important to balance provider panels so they and their teams are able to properly manage the care of their assigned patients. Consult with providers and patients to ensure alignment on the assignments. Remember, patients have the right to choose their primary care provider, and supporting this choice enhances their experience. When we assign or reassign patients at Happy Health Center, we also double-check that they are happy with the assignment. Empanelment allows us to leverage our expertise and provide quality care. By focusing on a specific group, we can effectively meet their needs and ensure they receive exceptional care. Thanks for stopping by. To learn more about empanelment, here are a few recommendations.